Welcome. My name is Dr. Clarissa Beiting, and this is Kim Reynolds, my nurse. We're here to discuss some post-op instructions and recommendations after laparoscopic surgery. This is not to include the hysterectomy. You can find that in a different video. So this is just straight laparoscopy, such as tubal ligations or exploratory laparoscopy, things in that nature. So laparoscopic surgery, Kim, so that is a type of procedure where you have the small incisions. We use the gas to inflate the abdomen to be able to do whatever we need to do, whether it be a tubal ligation or excision or fulguration of endometriosis or things like that. What do you find that the most side effects or symptoms of pain associated with those are?
So a lot of patients will say gas pain is a common symptom after this surgery. And again, that is to be expected. They are injecting some air with the procedure so that she can see and do what she needs to do. But if you do have gas pain, it is important to get up and move around. It's very easy for us to want to sit and not move, thinking that will help the pain, but actually it helps to move, to get our bowels moving, to help pass that gas. Some patients will even experience where the gas can rise up into the shoulders. If you're feeling pain, that kind of sharp pain up in both your shoulders, one thing an older nurse taught me one time was to get some like washcloths or towels wet and then heat them up in the microwave and drape over the shoulders, and that relieved immediately. So, but gas pain is very common after this procedure, and again, moving would be a big help for this as well.
Yeah, I feel like the gas pain's probably the worst with this, and it goes away pretty quickly. So usually after a few days, couple of days, most patients say the gas has gone down. Then I do think that patients start to get a little tender just where the incisions are. So typically I put some skin glue on the incision just to protect it from just the environment, any bacteria. We do recommend not getting it wet or submerging it for 24 hours after that is dry enough for you to shower and do normal activities. What kind of clothing do you think they should wear after this?
So because of the gas pain and, being sensitive where the incisions are, we do recommend wearing looser clothing. So maybe drawstring pants, just something with an elastic waist, something that you could roll down if you need to, and then a loose top as well will help tremendously.
Yeah, so I think something too tight, something to avoid just because of the discomfort. A lot of times the incisions may look a little red, and so I think sometimes people have a little skin irritation to either the prep or the skin glue. But we do also just notify us. We can take a look at those. Sometimes it can be an infection, but if it's usually every incision has redness, that's more usually of an allergic type or sensitivity to either the glue or the prep, which we see fairly often.
Yes, we do.
What about activity as lifting? What should we do with the laparoscopy?
So with this, we do recommend no lifting greater than 10 pounds for at least a week after surgery, just to give yourself some time to heal, to get this gas moving, to decrease that discomfort, and then slowly increase after that. And depending on how you feel and if you can tolerate it, increase your lifting as tolerated after the 1 week.
Yeah, I feel like with laparoscopy, if it's a pretty simple one, like a tubal ligation, you're pretty much back to full activity, exercise at like a week. Some of them are more complicated, like you have a bigger incision where you have to have an ovary removed, so they might be slightly bigger. It may take a little bit longer, but most patients are fully healed around 2 weeks with the laparoscopy. Driving, yeah, we don't want you to drive after surgery. I think, Kim, you see, like takes a few days, maybe 3 to 5 days.
Yeah. For the anesthesia to wear off and to be comfortable and not have the gas pain. It's something that might make you kind of look down if you were trying to drive.
Yes.
So I would avoid
driving for a few days. Yeah, I think that would work. We also recommend holding off on intercourse for probably that week as well, just because it can cause a little bit more tenderness with that. Some patients, can resume a full normal diet right after laparoscopy. I feel like if you're having a lot of gas, you may want to stick to the like a lower residue type diet.
Very simple.
Yeah, kind of bland. You do experience some vaginal bleeding. We do have some vaginal manipulators and things we put in the vagina. So it's usually not very heavy vaginal bleeding that you might have after surgery, but enough for a panty liner, and it might last 3 to 5 days after the surgery as well. So, Kim, when do you think some signs that patients should call the office?
Yes, if you get a fever, really anything over 100.4, please give us a call. Could be an indication of infection. She's talking about having some bleeding 3 to 5 days. If you at any time are saturating a pad an hour or less, just passing large clot, just very concerned. If you become symptomatic, such as lightheadedness or just feel very tired, please give us a call.
Yeah, those are good symptoms to keep in mind after the laparoscopy. Again, if you have any further questions, we'll talk about that at your pre-op appointments. We appreciate your time.